Hey guys, it's Dr. Abraham with A Simple Aesthetics, and today we are talking about the different types of neurotoxins like Botox, Dysport, Xeomin, and a couple of others. We are here with Annabelle today.
Hello. Thanks for having me back.
It's great to have you back. And we're talking about neurotoxins. So many people are familiar with Botox and how it's used to kind of smoothen the wrinkles. Botox is one of the first neurotoxins that has been available on the market for wrinkles and stuff, but it is not the only one. So we're gonna dive a little bit deeper into that topic today. Do you do a lot of neurotoxin? Do you like neurotoxins?
So much. I feel like it's our number one most done treatment, basically. And we carry quite a few brands here.
Yes.
How many do we have? Six brands?
Six.
Six
Okay,
brands,
yeah,
yes.
there's six. Those are the main ones that are on the market right now that you asked. Let's kind of talk a little bit about what they are. So they're all considered botulinum toxin type A.
Correct.
And so there's different, if we zoom out a little bit, there's different types of kind of botulinum toxin. There's type A, type B, type C, and so on. But typically it's botulinum toxin type A that is used in kind of cosmetics. And it has other uses too, but that's kind of the med spot itself. That's what you're getting.
Definitely. And then the six that we carry here, and remind me if I'm forgetting one, is Botox, Dysport, Xeomin, Daxxify, and which one am I forgetting?
Latibo.
Perfect. That's the newest one that we have.
So how come everybody knows Botox? Like a lot of people, when you've said these six names,
Yes.
almost everyone's gonna recognize Botox, but
For
not
sure.
necessarily the other ones. Why do you think that is?
Well, it's the original, I feel like. So it's been, the one that's been discussed more. And it's also been, there's commercials on TV for Botox. You don't really commonly see commercials of like Xeomin or Jeuveau, at least I don't. And it's been around a lot longer, yes?
Yeah.
Roughly how many years would you say Botox has been around?
So Botox has been around the longest for sure. I mean, it's been around since the 80s, but it wasn't initially used for,
Muscle relaxing,
exactly.
and for the wrinkles.
It was for muscle relaxing, but not necessarily for wrinkles.
Aesthetic purposes.
And we can talk a little bit about some of the other aesthetics, but it definitely still has like the largest market share. So it's kind of the one that's most well known, as you mentioned. It's been around since the longest, so most people are familiar with it because before, when it first came out, if you wanted to get Botox, it was Botox the brand name. Whereas now sometimes you hear people saying I want to get Botox, but then when you talk to them, they're actually getting like Dysport or Xeomin.
We just use the term now, Botox. Yeah, it's coined as like the phrase. It's like the Kleenex, if you will, of tissue.
Who wants to say I'm going to get botulinum toxin type A? It's just Botox.
That's a mouthful.
Easier, right?
I'm definitely not saying that.
Exactly. So Botox was the original, and then Dysport and Xeomin kind of came after.
Okay.
2009, 2010, if I remember correctly. I might be off.
No, I think you're right on. And then after that would it be Jeuveau or would it be Daxxify?
There was a while, and then Jeuveau, Daxxify came around the same time, and then lastly Latibo. So all of these are considered botulinum toxin type A, because sometimes people will think that one is type A and one is type B, but they all fall under type A. They have slightly different medical names, so like Latibo botulinum toxin type A, Abo botulinum toxin type A,
just like minute little differences.
Exactly.
Which one is your favorite? You have to pick one right now.
So what I like, my favorite thing to do is to kind of like switch it up a little bit. So because I do Botox on myself.
That's not a real answer, Dr. Adam. You have to pick one. You can't pick multiple.
I mean, Botox is kind of the one that I've used the most, I would say. And Botox it's the original, so it kind of always has like a special place.
That's fair. That's valid. I feel like that too about Botox.
That's the one
What's
that
your
most
second
people
favorite?
ask about by name too, is Botox. Most people come in when they're asking about one by name. Sometimes people are getting more and more aware of Dysport and Xeomin right now, and
for sure.
The new ones too, Jeuveau, Daxxify, as we mentioned. Latibo is still kind of like it's very fresh, so not as many people are aware of it. But I'm sure more people are gonna
start asking about it soon.
Ask about it. Do you have a favorite?
I kind of go back and forth. I would say right now I'm on a Jeuveau kick. But before that, I really did like Xeomin. I really did.
What makes Xeomin, kind of? difference?
Well, supposedly it's the cleanest of all the neurotoxins. It has less preservatives in it. So sometimes people are a little bit more health conscious. They'll opt to do Xeomin instead of, a Botox or a Dysport.
The different neurotoxin, most people are gonna have a very similar experience
For
with all of them.
sure.
There could be some slight differences, like in terms of, if you're listening to this and you've gotten one and not the other, and you're wondering about the differences, because they all fall under botulinum toxin type A, they're often used, in similar manners and similar,
Results.
muscles, and they often get similar results. We've seen people that they would feel one is gonna kick in a little bit quicker, or it might last, like, let's say, a little bit longer, a little bit less. That will also depend on the amount of the product
For
that you're
sure.
using, where you're injecting, how much you're injecting.
And I think with anything, people just develop a preference, for one thing versus another. And I kind of feel like that's what ends up happening too with neurotoxin. People just, they really love Dysport and they want to stay with Dysport, or vice versa. They really love Jeuveau. And then like those patients typically will stay with what they're used to using. So unless I recommend that we try something different because they're having an off experience, but all of them, between me, I've used all of them and I don't really notice too much of a difference between all of them across the board.
Exactly, yeah. Yeah, we have people who've tried multiple and they don't notice the difference, but we have some that will notice that they like one more than the other.
For
And I think,
sure.
if you're wondering, honestly, the best way is to try the different ones at different times and see which one is gonna like work a little bit best with your body.
So typically when patients come in and I'm explaining all the different brands we carry, I guess the most common question I get is, are they all the same price? They want to talk about pricing of neurotoxins.
Typically speaking, it's gonna vary from place to place, but typically they all are around the same price point. There might be some price variations, but it doesn't tend to be as huge. I feel like Botox and Dysport might be slightly pricier in some practices, or have less discounts. I think partly because Botox, because it's been around the longest, it kind of has the most research that has been done around it. And again, it's the one that's a lot of people are more comfortable with just because it's been around the longest.
Also, too, I think it's FDA approved for a lot of therapeutic reasons as well, whereas some of the other neurotoxins aren't yet.
Yeah. Botox does have a lot more FDA approvals than many of the other ones, because there's been a lot of research that's been done around Botox, and that also can play a part of it.
For sure.
That is something that we typically see. It's kind of like this pattern is something that we see in medicine, where kind of the first medication of its kind, which Botox was, it's a little bit harder for it to kind of break into the market, and then there's more research done. There's more, it kind of leads the way.
Yeah.
And sometimes
paves the way.
Exactly. Sometimes when these other products came, they just kind of want to show that we're similar to what's already out there, so they don't have to kind of do
the legwork
exactly
that
as much
Botox already did.
Exactly. They just kind of ride on that and like, okay,
Piggyback
so
on them.
Botox does all that stuff, and we're pretty similar.
Yes.
So
yes.
But many of them don't have as much kind of research as Botox had.
That makes sense why the pricing would be a little bit, in favor of Botox. That makes sense for sure.
And Botox, as you mentioned, can be used for so many other things, including migraines. And I think we've talked in different episodes about
the different therapeutic reasons.
Exactly. So we kind of took a kind of deeper dive in that episode. But you can use it for things like migraines, for hyperhidrosis or excessive sweating, whether it's on
TMJ,
your hands, feet, underarms, TMJ. Muscle dystonia, spastic muscles. People use it sometimes for, they have like their traps are
tense.
stiff or tense.
Absolutely. I've done that before and it worked really well.
Yeah. So there are a lot of uses for Botox outside of cosmetics, and we do a lot of these as well. Like these kind of stuff work and they're in demand, and I've seen Botox like do miracles when it comes to.
Because we were on pricing, I think too, another question that I get a ton from patients is the confusion with pricing in regards to Dysport, because, for every one unit of Botox is 3 of Dysport. So I think that causes a lot of confusion with patients.
Yeah. So sometimes they are measured a little bit differently. it's kind of like kilograms and pounds, or like centimeters and inches
Sure.
and stuff like that. If you're buying apples and you're buying 5 apples, and it's like 1 kilogram versus like 1 pound. A pound is gonna be less.
I have a strong opinion about this, and I feel like it was a marketing scheme on Dysport's end to
Who knows,
make the
maybe.
conversion a little sneaky and tricky, because it almost makes it seem like Dysport is cheaper than doing Botox because of the way that they do it. They're like, oh, well, my Dysport is only $6 a unit. Why
Yes.
is my Botox $14 a unit or whatever,
Yeah,
you know?
but then the
and
trick
then
is you have to use more Dysport.
yes, exactly.
kind
So
of do
I
the same
really
effect.
feel like it was a marketing thing more than anything.
Yeah.
And I think it works. I really do.
I think for the similar effects, it ends up being around the same price. But
For
yeah,
sure.
depending on how, and some people I've seen like many med spas where they just kind of use like Botox here, that they could kind of do the conversions.
Which I prefer. I think that's less
to
confusing.
make it less confusing. But yeah, technically speaking, it's cheaper typically for a Dysport unit, but you do need to use more Dysport units to get the same effect, which is why it ends up being around the same price.
Yes, sometimes even a little more, depending on how much they're pricing per unit of Dysport.
Exactly.
Yes.
Exactly. I think overall, I've seen all of them really do work. Again, sometimes we've seen people where there's some differences between one product versus the other. And many people, they come in and they're like, I've tried all of them and I really don't see much of a difference. I don't think it's a bad idea to try different ones at different
No,
times
me
and kind
either,
of see
for
how
sure.
your body reacts to it.
See which one you like better, you gravitate towards. The only other one that's kind of a little bit different, in my opinion, is Daxxify, because when Daxxify came out, they were promoting it like it was gonna last 6 months instead of, the 3-month duration. That hasn't been my personal experience. I don't know if you've ever messed around with Daxxify and you felt like it lasted the 5 to 6 month duration.
And so some of the studies where Daxxify lasted longer, the kind of fine note in there is they've used a significantly larger amount of units. So
Yes.
if you were to come in and I was to do 20 units of Botox in an area for you, versus if you came in and have done 40 or 50 units of Botox in the same area, you're probably going to get a longer duration with the 40 units than the 20 units.
Absolutely.
So, it's kind of like it's not a fair comparison in a sense if you're doing, 20 units of one
Yes.
versus like 4 units
For
of something
sure.
else.
Because the indication with Daxxify is whatever your normal dose is, you're supposed to double it, essentially. Correct?
In some of the studies, they used double the dose,
Yes.
yes. And so they got a longer duration. But again, if you're doing, you're not going to...
If you're doing a stronger dose of any of the neurotoxins, you're
probably going to get a longer duration. So that was kind of... But if you use a similar dose, it's probably not going to be that much of a different
Yes.
duration from my experience.
Once again, the marketing, 6 months sounds great in theory and makes people ask about it. So it's good
And
on
some
their
people,
part.
they will get 6 months out of their Botox before it's fully gone. Some people
Yeah.
will get 3 months, some people will get 4 months. So it will vary from person to person, just depending on how your body,
Metabolizes.
metabolism
For
is
sure.
and how your kind of muscles react to it and how they recover. Well, hopefully you guys found this kind of helpful. Again, the 5 or the 6 now are Botox, Dysport, sometimes pronounced Dysport, Xeomin, Jeuveau, Daxxify, and Lativo. Hopefully you guys found some information helpful. Make sure you join us next week for our next episode, and leave us comments, questions, and make sure to subscribe. Hit that like button, give us a 5-star review if you like the episode, and make sure you join us next week for the next one.